Thank you. Since Ms. Tamas has to leave, I'll just ask Ms. Tamas my questions, and if I can get back on cue to ask the undersheriff the rest. Thank you very much. So thank you for being here. I'm familiar with your report from LA County. Also, I appreciate you framing your comments with the statistic that you shared it. And I heard it a little different, Senator Berryhill. I heard not a higher proportion incarcerated, but a 1 in 3 chance for young African American men for having an interaction with law enforcement. And as the mother of a preteen male, I can certainly attest to that with his first stop and frisk experience already occurring as an 8th grader in clear view of the school bus, and his Caucasian classmates not being asked the same questions about where you're coming from and where you're going. So I can certainly attest, in addition to the stories we hear from our constituents about those percentages of interaction. So I appreciate you framing that and sharing that with us. A couple quick questions. You talk about the New York pilot where you're looking at lifting the ban on public housing. I'm curious as to your opinion if we were to lift some of the bans on public benefits here in California, the ban on SNAP and CalWORKs, the impact that would have on providing appropriate support to reentry.
Absolutely, and these are all things we term collateral consequences of a conviction, and those are absolutely barriers, as you suggest, to someone's chance of success when they re-enter the community. And we actually just looked at legislation across the country over the 2013 sessions, and states are doing that, are making those changes everywhere. And I know
they're
California is
or
among them, that they're reversing, right, that they're taking them away. And I think actually there was a question earlier about Texas and increasing incentives for employment. And I think that Texas was one of the states that passed the removal of negligence in hiring for employers if something were to go wrong at the workplace if they hired someone with a conviction. So those things are essential, for people to have benefits. In LA County, it's a system I'm most familiar with, that they're now doing inReach with this, social services, and all of these other agencies are coming in to help people get their license, or some kind of California ID, to restart Social Security benefits, to get CalWORKs, to get all of that stuff going. Because without that, right, someone's walking out the door with literally nothing, and we're expecting them to somehow, I couldn't do it if someone let me out the door with a bus token and I had nothing on me. I'm not sure where I would end up.
One more. You both talked about the critical importance of employment and how employment is the critical factor in terms of avoiding recidivism. I love I'm going to remember that one. Recidivism. Is anyone assessing the effectiveness of the job training programs, either the academic training programs that are either happening in jails or prisons, or the community-based job training? We talk about it's the critical piece, but do we know how effective the current programs are that are supposed to be aiding and abetting, for the lack of a better term?
Yes. We do, and I don't have all the statistics in front of me, but I can absolutely get them to you, especially with the Second Chance Act, the federal grant money that went to a lot of beneficiaries. They're all, required to track outcomes, and they're showing very good success rates with many of those programs. We're also involved in a very large Department of Labor initiative where we're directing a program called Youth Futures across the country in Los Angeles, Chicago, and New Orleans, where we subcontracted with providers in each of those cities to provide pretty intensive workforce development and employment programs targeted at youth, starting at age 14 and up, who have been in the juvenile system. So I would say yes. That there are evaluations going on and that have been conducted on employment programs, and you're also correct in suggesting that there is a range, that there are a lot of programs out there, and our real, my point here for you all is, to make sure that we are evaluating each specific program and making sure that it's doing what it's supposed to be doing, which in this case is reducing recidivism and keeping people crime-free and, safe in their communities.
And just very quickly, you gave a couple of examples of partnerships with LA County that are working really well. Any of your recommendations that were included in your policy paper that haven't been implemented that you wish had been?
Of course.
Just give me your top one, just one.
Everyone. I would say, going back to the large study that we did on jail overcrowding.
That's the one.
We really were focusing on the pretrial population and creating a new pretrial risk assessment and a new way of moving people out the door at the front end.
Okay.
I think that's the big one because, again, I think that's where you get the most bang for your buck. Also, I would reemphasize Assistant Sheriff McDonald's point about people with mental health and that there have to be diversion programs for them. And even if they are in the system, that we've got to do a better job, of moving them out quickly and getting them into community-based treatment. And we heard that. We interviewed police officers all over LA County, and they were the ones who told us, they have to respond when they're called on the street. If someone's in front of a business, if they're yelling, if they're doing something, and the police are in this, the cops are in this situation where they don't know what to do with the person, and they end up bringing people to jail. And I think we would all agree that jail is not the suitable place for treatment of people with mental illness.
Thank you. Thank you.
Thank you, Senator. Ms. Davis, you are welcome to stay with us the afternoon. We also don't want to be responsible if you're missing a flight, so take your leave as you must.
I will.
We have questions from Senator Monning, Senator Bell, and Senator Roth, possibly.
Thank you. Before Ms. Tamas has to leave, and you're free to leave, I just want to thank you for your work and your presence, and both of you. Assistant Sheriff, you did reference Affordable Care Act, and one of our areas of interest is with expanded eligibility and the commitment under the Affordable Care Act for mental health treatment, drug rehabilitation, alcohol, tobacco cessation. One of our challenges, as you'll recall from the state prison system, is incarcerated inmates in our state prisons aren't eligible for Medi-Cal, Medicaid. It sounds from your earlier comments that for pre-trial inmates, there may be a way to qualify them and get payment for a program even in a pre-trial status. Could you share with us some of the challenges you're facing for qualification and what we might do or what we would need the federal government to do to expand access to Medicaid, Medi-Cal money for drug treatment, mental health treatment sooner rather than later?
Certainly. The first one was the IMD provision. I think that is going to be by and far the largest barrier. I do believe that our pre-sentence, pre-trial population will be able to do alternative custody programs funded through Medi-Cal if that facility can provide it. I also believe our sentence population can do that as well. One of the challenges with the pretrial population in LA County is that the sheriff doesn't have jurisdiction to move people out pretrial. That jurisdiction relies with the courts. And so if they don't do it, we don't do it. One of the things we're going to do in LA County is ask the Board of Supervisors for consideration to allow us, the Sheriff's Department, if somebody shows up low risk and they have benefit enrollment through Medi-Cal and we can find a bed for them, we move them out into that. But I think that IMD, if we can get some help, if at all possible, with the federal government on IMD, that will open the system for the providers and us.
Senator Monty, might a waiver be even...
Pardon?
A waiver be possible? Something we might ask
yes, something
those
to
in the
pursue.
know.
Absolutely. Yeah. And then what are your current resources to help qualify people for that eligibility? And how does that affect taking full advantage of what's available today?
Well, sir, we haven't had any resources until yesterday. Yesterday, the state announced for LA County that we were awarded $7.7 million for benefit enrollment. And half of that money's to be awarded to community-based organizations to help find beds and for us to get people enrolled. So right now, we got a little bit of help, and I'm hopeful that gets us going in the right direction.
Well, thank you. That's very helpful. We'll look at the IMD issue. Thank you.
You're welcome, sir. Thank you.
Thank you, Senator. Senator Bell, Senator Roth.
Yes, last year I was in LA and Sheriff Baca testified at the Select Committee on Mental Health and outlined a lot of the ways that you're talking about here. And we issued a report from that hearing. We had several different ideas that we've been talking about over the last 6 months, one of which was following up on the IMD exclusion. There's a California law that defines drug Medi-Cal programs as medical services. And as you know, the IMD exclusion says medical services that are over 16 patients are not eligible for Medicaid funds. However, recently the SAMHSA, which is our Substance Abuse Mental Health Administration, says that they're talking about the difference between medical residential services with, like licensed psychiatric doctors and so forth, versus a non-medical facility, which in the main are people with staff without this medical training, but trained staff, treatment programs. And they say if we change the state law that says that drug Medi-Cal programs are defined as medical, and we can say they're defined as non-medical and medical, that would allow the IMD exclusion to be overturned for those kinds of facilities, allowing the Medicaid money to flow. Do you have a comment on that? The type of facilities would be the ones that don't have a staff on site, medical doctor or a psychiatrist. Can you comment on that?
My comment would be as long as the site was providing appropriate services and there was supervision of the population, I think we could be greatly supportive of that.
Okay. We had a program in Los Angeles, I know you and other counties, it's called a Full Service Partnership Program. And we talked about, that's one where everything's integrated, housing, medical care, counseling, employment services, case management. How is that as a model to deal with some of the people that are in your facilities?
This concept of wraparound services, full service partnerships, because most people in jails and prisons have extensive needs, no singular need. And so treating each individually holistically is the right approach. They are complex and expensive approaches, but it's that front-end investment that makes such good sense, Senator.
And then Los Angeles County is doing some work on Medicaid treatment in your facilities. And my understanding, you're doing a pilot program on for opiate-addicted inmates. Can you, what kind of revisiting results are you getting out of that study? And that involves, like, I think it's buprenorphine and Vivitrol and other, I don't know if it's methadone, but we're talking about individuals that have addictions that you are treating in your facility, and what kind of results are you getting out of that?
Talking to our partners in substance abuse treatment, Vivitrol is one of the most promising drugs for drug addicts. What it does is it serves as an inhibitor to getting high. Unlike methadone, that methadone becomes a substitute addiction, Vivitrol really blocks that addiction. We have a pilot going on in our mental health unit. I don't have any statistics yet on promising results from that pilot, but experts in the business will say Vivitrol has been very promising. It is expensive. Yep. It's a one shot, and it ranges anywhere from, I understand, $550 a shot to well over $1,000 a shot. And so it's another friend.
How long?
30 days.
30
and so it's a decanoate. It lasts for 30 days, and oftentimes 30 days is about all they need. But some people need it for a lifetime.
Yes, and I think those kinds of programs are important to look at. Can you comment on programs that you have for your women that are in your facility? Do you have any specialized programs, and what kind of models work specifically for that population?
So we have a gender-responsive approach to our females. We've modeled much of what we've done after national best practices. The National Institution of Corrections came out last month or a couple
Yeah,
months
right.
ago to work with us on that matter, and we actually have a committee who helps us.
They were
So-
focusing on like a trauma, they called it a trauma-based program. Can you explain that? That's kind of what I heard from that study, I think.
So statistics show that well over 50% of women have been victims of sexual assault. Approximately 25% of male inmates have been victims of sexual assault. The difference between women and men is young men tend to be assaulted, but they break away from that. They join gangs, they run away from home in their early teens. Females tend to stay for a very, very long, protracted period in that sexual assault stage, and it lasts well into their adult life. So when you're dealing with female offenders and female inmates, you have to understand that's the world in which they come from. And trauma-informed simply means that you understand that they've been sexually victimized, traumatized as you're interacting with them.
Okay. Do you think that we need more programs in that nature in the state prison system?
Absolutely, but I do know they do have an approach towards that. We can grow it as well, though.
Thank you. Thank you. Thank you, Mr. Chairman.
Thank you, Senator Bell. I have one quick question, then Senator Hancock has, and then we're going to move on to our next part of the agenda. But thank you for staying with us so long. Just see if you have any counsel you can offer us. Senator Hancock had a bill on the Senate floor today which had the good fortune of passing off the floor, but not for, in spite of some significant opposition. Opposition from statewide law enforcement organizations. It had to do with risk assessment, an optional program, imposing nothing on anybody. We've heard so much about the need for risk assessment today. It was a minor reform proposal, but because state law enforcement organizations oppose it, it influences how legislators consider the measure. How do we get to some of these statewide organizations to begin to recognize that we're moving in a new direction? And I want to be very appreciative of those that did support realignment. But on many attempts within the legislature that I've seen over the many past years, there's a resistance to change, that the status quo is what we want. They may even know better, but the nature of the organization is such as they've got to survey all 58 members of their organization, and oftentimes the majority is against any kind of reform. Which actually leads to my other question, which is, what would you say to your counterparts in counties that are still complaining about realignment, claim, and we may hear this from the PPIC presenter, that I think it's far too early to make any definitive causal relationship between any kind of data we have in the past year or 18 months with regard to realignment. It's far too early to make conclusions, but there are those within local law enforcement who claim that a small uptick in certain categories of crime are responsible for, is due to realignment. But, as I said earlier today, LA County has been a high realignment county, and your crime rates have gone down. So what are you doing so right? What advice could you give to some of these counties that are still struggling so? And I know it's a sincere struggle, but they are still struggling, and some of these are the same counties that are resistant to any kind of reform or change.
Well, I had the opportunity to be kind of the corrections public face to realignment to the counties. And I will tell you, most law enforcement leadership stood shoulder to shoulder to deal with this issue. But these are difficult issues.
Yes.
I think it's far too early to try to attribute trends, because violent crime in California is down. So would we say that's due to realignment? We wouldn't say that. Any more than...
Why shouldn't we?
Yeah, well, it's not the right thing to say.
Of course, of course.
Realignment could have some role in property crime uptake. It could.
Yeah.
But it could be other things. It could be unemployment. It could be a new strain of narcotics coming in the county. There's a lot of ifs, ands, or buts. Here's what I say. I say that we just have to continue to listen to each other and work together and understand that some things seem easy, and they're very, like risk assessment tools, they can be very, very resource intensive. So working together to reduce keystrokes in risk assessment, working together to provide evidence and education about what works and doesn't work, listening to concerns, and just keep doing this together. It is so early in realignment. And frankly, California ought to be proud of itself for the leadership team that stepped together, because this can't be taken in a vacuum. You know, this was in lieu of a potential massive state prison release.
That's right.
And so you got to take it holistically. So we'll just continue to lead together and know that your public safety folks are trying to do the right thing for their constituents. They are. And their heart's in the right place.
Not surprisingly, very wise words. Thank you. Senator Hancock, and then we'll conclude this part of our agenda.
Yeah, I just wanted to thank everybody on the panel but you, Terry, because you're still here.
Nice.
Thank you, and for the wealth of experience that you do bring to this discussion. And I wanted to thank you because people may not know, but there was a move a few years ago for the department to close down after realignment one of the programs for women prisoners with children that absolutely was changing lives. And you were able to work within the system and to get that not to happen to the immediate group of women. And I hope you have the same luck and grit and determination to do the things that we know need to be done in LA and across the state. I'm going to want to be in touch with the Vera Institute. I just want to say on some of the things but maybe you can shed some light on it. This business of focusing on that middle group that's most at risk. I think that's a good way to look at it. I'm also very interested in how we skim off the top, if you will, the first-time young offender who was in the wrong place at the wrong time and maybe doesn't read very well, but that kid is scared to death, and if he could get an education and a little help while incarcerated and then go on with the seamless system and other things we've talked about, you know, if that's 10% of the population even, you've got 10% fewer people coming back. So how are you dealing with that population?
So in LA County, and I agree with you, that's a really sweet spot population. We know the recidivism rate is lower on first-time offenders than repeat offenders. Shouldn't be shocking, but that is true. That so in LA County, we have a youthful offender program. The state has one as well. And so finding out ways to incentivize that, maybe getting federal drawdown dollars, getting some money from charter school opportunity, where we're sorting out those youthful offenders and really, really targeting their needs. Now, let's be frank, those can be some of our most challenging gang-entrenched youthful folks, because they tend to need each other's peer pressure more. So taking a 1-2 approach, which is clustering, dealing with their educational criminogenic needs and dealing with gang entrenchments while they're there, Senator.
And that's a whole other topic that we probably could use several hearings on. Well, thank you. I mean, this will all be very, very useful for our budget discussions and our policy discussions. Thank you.
Thank you so much for your time.
Assistant Sheriff McDonald, we really thank you for all the great information you brought us today and for your years and years of important service to the state. So thank you all for bearing with us. It's a longer hearing than we may have imagined, but it's been a very valuable one for everyone on the committee. We are going to ask the Legislative Analyst's Office to join us. That would be Mr. Aaron Edwards. And then we're going to ask Mr. Lofstrom to bear with us. Mr. Hoshino has a schedule restriction, so we're going to move to the Department of Corrections following the LAO.
Good afternoon, Mr. Chair and members. Aaron Edwards with the Legislative Analyst's Office. Your staff asked us to come here today to provide an assessment of CDCR's blueprint, and specifically they asked us to speak to two particular issues. One is, did CDCR achieve the blueprint reductions as they were projected in the blueprint? And the second is to compare the reductions that were made to CDCR's budget to the amount of funding that was provided to locals as part of the 2011 realignment. So to that end, I've prepared a handout, which you should have in front of you now. It's entitled The Assessment of CDCR's Blueprint. So if you'll turn to the first page of the handout, I'll provide a little bit of background that I think is important to provide some context for our findings today. So in 2011, the state enacted legislation that realigned responsibility for managing certain felony offenders from the state to counties. And this was done largely in response to a federal court order requiring the state to reduce the prison population to 137.5% of design capacity. Shortly thereafter, in April of 2012, the California Department of Corrections and Rehabilitation, or CDCR, adopted what they called a blueprint, which was basically their plan for reorganizing various aspects of CDCR's operations to account for the effects of realignment. And specifically, the blueprint had three main goals. The first was to reduce the size of CDCR's budget commensurate with the reduction in the parole and prison populations. In addition to that, the blueprint was intended to achieve long-term compliance with the federal court order to reduce the prison population, and it did this in part by assuming that the court would allow us to overcrowd the prisons up to 145% of design capacity. And then finally, the blueprint was intended to implement various operational changes, such as revising the inmate classification system, as well as increasing access to rehabilitation programs. So if you'll turn to the next page of your handout, we provide a summary of the various budget and population reductions that CDCR projected it would achieve as part of the blueprint. So the blueprint projected that the state prison and parole population would decline by tens of thousands of offenders. So if you look at the far right-hand column of that figure, you can see that the prison and parole populations were projected to decline by about 26,000 and about 52,000 individuals, respectively. And in addition, the blueprint intended to make certain reductions to CDCR's budget that would total about $1.5 billion. That's the top line, the first row of that figure. And those reductions were tied primarily to the elimination of about 7,000 positions within CDCR, as well as the elimination of about 8,700 contract beds. Now, we want to note that these projections reflect planned reductions to CDCR's budget that are specifically related to the implementation of the 2011 realignment. The projections do not reflect other changes to CDCR's budget that have occurred or that may occur during this period, such as increases to employee comp. And you're going to want to keep that in mind as we discuss our findings on the next page, and I'll explain why in a moment. So if you'll turn to the third page of your handout, we provide a figure which summarizes the projections that CDCR intended to, the reductions that they intended to make to the budget at the time of the blueprint, which is the lighter bar on the left-hand side, compared to what the actual reductions and the revised estimates of the reductions are. And so you can see that in the first year of realignment, the CDCR essentially hit their reductions target in 12-13. However, in 13-14 and 14-15, we're estimating that they're going to miss their targeted reductions by about $240 million and about $530 million, respectively, in those 2 years. The differences are largely attributable to two main factors. The first is that the administration was forced to spend a lot more than anticipated to comply with the federal court order. And the second is that the prison population has turned out to be a little bit higher than was expected. Now, as I was saying before, I think it's important to note here that what's in the numbers that are underlying this figure. So again, we looked specifically at the reductions that CDCR intended to make as part of the blueprint. We did not look at other reductions that may have occurred over that period that were unrelated to the blueprint. And a good example of that is employee compensation. There was, subsequent to the passage of the blueprint, an MOU signed by the administration that increased employee compensation. So because that was not part of the blueprint, we did not account it against CDCR's ability to achieve their targeted reductions. So if you'll turn to the fourth page of the handout, we'll talk about the first factor that really prevented the department from meeting their targeted reductions. And that was that shortly after the adoption of the blueprint, the federal court rejected the administration's request to raise the overcrowding limit from 137.5% to 145%. In response to that, the legislature adopted SB 105, which provided funding to the administration, to CDCR, of $315 million to use to contract out for additional capacity in the event that the court did not grant an extension. And if the court did grant an extension, that money could be used to invest in programs that could reduce the prison population over the long term. The governor has not, to this point, been able to achieve the requested increase in the population cap, and so as a result, the administration is projecting that about $228 million of that $315 million will in fact be needed for contract beds in the current year. In addition to that, the administration is requesting about $500 million, or specifically $489 million, in the 2014-15 budget year for additional contracts and some rehabilitation programs that are intended to comply with the 3-judge panel order. So if you turn to the fifth page of your handout, we'll talk a little bit more about the second major factor that prevented CDCR from achieving their targeted reductions, and that is that the prison population turned out to be a little bit higher than was anticipated. So if you look at the chart, the bars on the left, the lighter bars represent what the blueprint projected the prison population to be, and the darker bars represent the actual and revised estimates of the prison population. And so what you can see is that in all 4 of the years, the blueprint's projections were actually below what the actual and revised estimates of the prison population turned out to be. And in fact, as you move from left to right on that chart, you can see that the gap actually grows over time. And so the blueprint projections are further below the actual and revised estimates. For example, if you look at 2013-14, the blueprint projections are about 9,600 inmates below what we now estimate the prison population to be. And then if you go out to 2015-16, that gap actually goes to 17,000 inmates. So there are several factors that may be contributing to the higher than expected prison population. The first is that there were some issues with CDCR's projections. They of course use the data to create their best guess of what the population impacts would be at the time, but they had some bad underlying data on who would be eligible for realignment, and that led to them projecting that fewer people would be coming to prison than actually came to prison. The other major change was that there's been a significant change in county sentencing practices. And I think the most important thing to mention here is there's been a pretty drastic uptick in second strike admissions. So if you look at just the first full year following realignment in 2012-13, second strike admissions actually increased 33% just in that 1 year from 2011-12 to 2012-13. And then finally, there's been a slight uptick in the crime rate, which may have led to increased crimes and increased felony convictions and increased people being sent to state prison. So if you turn to the 6th page of your handout, we provide a comparison of CDCR's budget reductions to the amount of funding that was provided to counties for the public safety portion of the 2011 realignment. So that portion of funding that was provided to counties is represented by the darker bar on the left, and then the bars on the right represent the reductions to CDCR's budget, with the cap, the lighter cap on the top representing the portion that CDCR was unable to achieve of those reductions. So the blueprint assumed that in each year, the amount of funding provided to locals would be less than CDCR's budget reductions. And in fact, that did turn out to be the case in 2012-13, and again in 2013-14, although in 13-14, the amount by which the CDCR's budget reductions exceeded the funding to the locals was smaller than expected. But if you look at the 14-15 year, this trend actually reverses, and you can see that the amount that was provided to the local governments in that year actually exceeds what we're estimating CDCR's budget reductions will be. And then finally, if you turn to the last page of the handout, we conclude with some thoughts on a kind of bigger picture question of what the overall net fiscal impact was on CDCR's budget of realignment. And to put that question another way, you could ask, well, what would have happened to CDCR's budget had realignment not been passed? And I think the short answer to that question is we really don't know, and it's impossible to really tell. And the reason is we can kind of reasonably conclude that the prison population would be much higher today if we hadn't enacted realignment, perhaps by tens of thousands of inmates. What we don't know is what steps the state would have taken to accommodate those additional inmates while trying to, at the same time, follow the federal court order to reduce the prison population. So, for example, the state could have contracted with additional private facilities to house those inmates. Or the state could have constructed additional prisons to house those inmates. And in either of those cases, it's reasonable to expect that CDCR's budget would be a lot higher than it is today. Alternatively, it's possible that the state could have made some sentencing changes to reduce the prison population, or the federal courts could have ordered the state to release inmates, in which case CDCR's budget would probably be a lot lower today than it is. So that concludes my remarks. I'm happy to answer any questions you might have at this time.
Thank you very much for the presentation. We do have questions for you. I think it's fair to say from what you've just shared with us that the blueprint, and I'll be as gracious as I can be here, may be of less value than we had once imagined. Number one, the premise that the three-judge panel was not going to prevail and that we somehow were not going to have to comply, I think, undercuts the whole thing. But beyond that, you've also pointed out that, using your words on page 5, there were issues with the original projections. So even their own math wasn't good. So I'm just going to put the blueprint aside from now and express concerns independent of where we are and where we're going relative to the blueprint. We should be concerned about where we're going relative to where we've been, both with prison population and cost of the system. And we're going in the wrong direction. And I realize there are complicated issues here, but I remember in my own, and I stand in solid support of realignment, and I believe it will bring ever greater returns in the years to come. And as you pointed out, we can't know exactly where we'd be without it, but it would not be nearly as good as where we are. But I remember one of the points I used in my promotion of the proposed realignment at the time was that where we've seen the percentage of our general fund spent on corrections grow from 3 to 5 to 11%, that once realignment was fully implemented, we would be closer to 7%. But I don't see that happening right now, and I'm beginning to think we're yet to deal with some of the more core and infrastructural problems that's driving the system. And until we get to those issues, we're not going to really change the direction of the ship here. Sentencing reform you've mentioned, we've not really done. We put some relatively minor reforms on the governor's desk last year. He vetoed them. The suggestion of the veto message was, let's not do it piecemeal. We're going to do something more significant in the year or years to come. Well, that's a good hope, but it's just that at this point. And then we're now beginning to take baby steps toward investing in rehabilitation, drug treatment, mental health services. But maybe it's time to call for a Manhattan Project, that we really have to step it up incrementally because the need's so great and the recidivism rate is not coming down to where it needs to be. We're not yet talking seriously about sentencing reform. So this is just going to go on, and the projections are we were hoping to reduce the population, again, independent of the mandate of the court or the suggestion of the blueprint. We need to get it down. Mr. DeVore was so eloquent today in how it can be done. And I get there are politics involved, but I would suggest we have to surmount them if we're going to make any real progress. So not only is the population not coming down, it's going up. Not only are we not saving billions of dollars, we're spending more. And I wanted to ask if, and I know you've had suggestions over the years, but if you could reiterate them and remind us what, from your perspective, your analytical, nonpartisan, independent perspective would suggest we really need to do at this point, if we're dissatisfied with where we see the numbers going.